Good morning, Dr. Rosen here. I'm going to try to give you a couple examples on some exercises that I routinely explain to my patients after knee replacement. People tend to make a big deal about the idea of physical therapy after knee replacement, and it is very important so you obtain a good outcome. But when you break it down to its simplest parts, I try to get patients to understand that the knee essentially has two functions. It straightens and it bends. So all of the exercises that we teach you after knee replacement are all different variations on that theme. Now, one of the simplest exercises that I find with my patients, they get benefit by working on the extension, is something that they can do in between therapy sessions. So this is something that you'll do multiple times a day, after eating your meals while you're sitting at the kitchen table, or while you're watching TV, or if you're sitting and talking to a friend when they come over to visit you. So 3 steps to this procedure. The first thing is when you're sitting, get a stool or a chair or an ottoman. You'll put that out in front of your foot. What you'll do is you'll take your foot and you'll just go up and rest it on that stool or chair, and your knee will be slightly bent, and then it will start to straighten. So that's step 1, it's just letting gravity bend the leg. The next thing that you'll do is when it's sitting there, you'll do your isometric quad sets where you'll fire the quadriceps muscle. The therapist may teach you this as activating the muscle, or pushing the knee down, pushing the knee straight, or pushing the muscle so your kneecap comes up. But in any event, you're firing your quad muscle, which will also help straighten the knee. So step 1 is keeping the leg or heel on a stool, chair, ottoman. Step 2 is firing the muscle. You want to hold it for about a count of 10 or 15. The third step in this is when you push down, use your hands and you can help push it down another degree or 2. All of this is an attempt to get the leg straight. The leg's more comfortable being bent, but we want to work on straightening to make sure that you get a good outcome. So that's the easiest exercise on getting your straightening after knee replacement. The next exercise that I like to review with people is a simple exercise to work on the bending. So what you'll do, and I have my patients do this a minimum 3 times a day, breakfast, lunch, dinner, you're already sitting in a chair at the kitchen table. And what you'll do, I slide back here a bit so you can see my foot a little bit better. What you're going to do is you're going to take your leg and you'll slide your heel back as far as it goes. And you notice my knee's not even at 90 yet. Your knee will feel tight. It will be sore. But that'll be the first step. What you do is leave your foot where it is on the floor, and then take your bottom, make sure that you're on a solid chair, and scoot your butt forward just an inch. Notice my knee bends a little bit more. It's going to hurt. You're going to want to lift up, but try to sit down, let the knee bend. After you've done that for a little bit, sit back again. Catch your breath, take your foot now. Use your muscles, slide your heel back some more. Notice my knee's bending now, it's closer to 90 degrees. Repeat the process. Move your butt forward, the knee's going to bend. Really try to sit down, let the knee bend as far as it will, and then sit back. Catch your breath, take your foot, move it back again. So now what we're trying to do is each time that you move your butt forward, you're stretching the knee, getting better bend, and then when you sit back, you want to use your muscles to bring that leg back as far as it was. Now the goal is to try to get your heel back a little bit underneath the chair, but most people get to the point where they don't have the muscle strength to pull the leg back. What you'll do for your last one is take your good leg, push it back one more time, and bend into it. This exercise should take you less than a minute. Something that you can easily do with just a chair, your leg, and an extra stool or an ottoman. You have both your straightening and bending exercises. By doing both of these multiple times a day, in addition to your other therapy exercises, you will see huge gains both in your motion, shorten your recovery, and decrease your pain. Hopefully this helps in your recovery.